retain internal moisture and repel external water. And also, medical grade olive oil is slightly acidic, and that our ears should be slightly acidic. The acidity in our ear is quite important because it helps to inhibit harmful bacterial and fungi growth. Quite often, if you've got an outer ear infection, so otitis externa, your pH level of the ear would be elevated, so it becomes more alkaline. And quite often, many antibacterial ear sprays do contain acetic acid, which is around 2 or 3 on the pH scale, so it's quite acidic solution. So I'm just using the fine end now to peel away the anterior layer of skin. You can see that I've removed a lot of skin already. We've used the forceps, and underneath is a nice healthier looking ear canal. There is one part of the ear, and I don't know whether you've noticed it already, and we are going to focus on it as the video continues. It's just at the bottom of the screen there. There's a piece of hardened keratin that's embedded within the canal wall, and it could be underneath that keratin we've got some exposed bone, and that will need to be removed. I did try and remove it today, but it was rock solid. It was, every time I made contact with it, it was so hard that the instrument would glide off it. And so I've referred the patient to ENT, and prior, because even upon removal, which may not be possible just during a normal outpatient appointment, the patient may need a subsequent appointment where some topical anaesthesia, so some local anaesthetic may be injected or applied into the ear, and it's very likely that the patient will need a CT scan just to get an idea of what's going on with the surrounding bone, because if that bone gets infected, so we call it a canal cholesteatoma, that's essentially what I'm concerned about. Canal cholesteatoma is when skin that lines the ear canal, instead of dying and shedding and migrating out the ear, it forms and embeds itself into the ear canal, and a canal cholesteatoma, so just dead skin, keratin then gets infected, and it can be quite dangerous actually. This infection can spread all the way around the ear, and it can infect the bone, the temporal bone, call that osteomyelitis, and this infection can then spread upwards towards the skull base, so just below the brain. It can spread to the bone behind the ear, the mastoid bone around the jaw area. It can affect the facial nerve, and because the brain is just on top of the ears, you've got the meninges, and it's a protective buffer solution which surrounds the brain. It's a fluid that engulfs the brain, protecting it from trauma, and the dura, which is the layer of the meninges that's most nearest to the ear, that can get infected if the bone around the ear is infected. So it can be quite dangerous. So for that reason, we don't want to take anything by chance. I did try and remove it myself today, but as I said, it's too hard. The patient will need to use some sodium bicarbonate drops for about a week or two prior to their appointment with ENT to really soften that keratin. I've just put some olive oil into the ear because there was a bit of dead skin that was a bit more adhered both laterally here near the entrance and also near the eardrum. And once more, I'm just using the fine